The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
That'll lead us right up into our Q&A portion. First question, general VED question. Does a VED require a prescription?
No, it does not. You could actually get these, MenMD, obviously this version of it, the Owens and Mumford one is fantastic. It's probably the best one out there in terms of mechanical device. The one thing I would say is, so the long and short is no, you don't, and you can get access to it. I generally like to recommend the mechanical device. This right here, again, is probably the best one out there on the market because it comes with all the necessary pieces as well as great instructions and video guides. So this is the one I recommend to patients.
Certainly, yeah. Definitely one of the less invasive ED treatments. Is how we on the other webinar events, when we list them out from pills to implants, we usually list this one as first or second. So yeah, something to keep in mind if you're climbing the ladder and trying out all the tools there. Alrighty, next question here. Can proper use of a VED enable you to achieve and maintain an erection when not using the VED? So I think they mean in terms of like training, I guess, if you would.
Using the VED, can you use it as a form of training?
Yeah, so I guess they're basically, what I got from that is they're asking if using the VED the right way, one day maybe they can, sustain and maintain an erection the same as a VED would give them.
Good question. There's a lot more variables involved in that, but if you have mild erectile dysfunction, the VED can help with, at the very least, maintaining it, or at least plateauing at that level so things don't get worse. I would say there may be a small improvement, overall improvement. It's not going to be a significant improvement, but the key thing here is it delays the worsening of your erectile dysfunction at the very least.
Alrighty.
And it obviously causes no harm, so it's a no-brainer.
Yeah, for sure. When used the right way, it is relatively side effect free. So next question here. How can I keep an erection after using the vacuum pump? Bit of a review.
So the constrictive ring is what really helps with that. It sounds like you're using the vacuum erection device the right way in order to attain an erection. Now we're talking about maintaining it, and that's what the constrictive ring is for. Sizing up your penis, your flaccid penis, using the guide, you can find the right constrictive ring size for you, and using that onto the adapter, onto the transfer ring, can really help to maintain the erection after you have attained it.
Alrighty. Next question here. What is the average time of erection in minutes or hours when using a VED once a full erection occurs?
That's a question for you. So it depends on how long it takes you to ejaculate. The vacuum erection device won't change how long it takes you to, in terms of how long the erection lasts, really comes out to how long before you ejaculate. But the vacuum erection device has no impact on that.
Certainly. Next question here. Can VEDs help with venous leak?
Yes. I'd say the combination of the vacuum erection device plus the constrictive ring can help with venous leak. Historically, one of the ways in which we've dealt with venous leak is the constrictive ring. By putting the constrictive ring on, you're able to get blood, not only able to get blood flow in the penis, but you keep it there. So the constrictive ring helps with keeping the blood flow in for sure.
Okay, next question here. Some advice on using this without getting embarrassed with your partner. They asked if you can. I think that's you definitely can. So maybe just some tips on how to use it without being embarrassed.
There's no hard and fast rule on that one, but like anything else, open communication. I don't think I've ever had a single story from a patient who said my partner, made me feel embarrassed by this or made me feel ashamed to use it. But opening up the dialogue, you're doing this not only to help yourself, but to help, you're showing up for your partner in a way. So just communicating with them about that and asking them for support really is probably the easiest way of starting that process.
100%, yeah. Alrighty. Next question here. Does the vacuum pump eliminate the need for trimix or other shots to gain a solid erection?
The vacuum pump is probably one step below trimix and the injectables. A lot of times guys who are using the oral therapies, they're like, I want a little bit more, I want a little stronger erection, but I don't necessarily want to use the injections. So vacuum erection device is good for those in those scenarios. If you're using trimix, there's no point in using the vacuum erection device, because trimix and the other injectables will help you get an erection without a vacuum erection device.
All right. Let's see. Next question here. Is it safe to use a VED more than once in a 2-hour window?
Yeah, so you want to give it at least 60 minutes in between sessions. So if you want to use it twice, and it depends how long you've used it, but as long as you're not using it, as long as you're giving yourself 60 minutes in between from the time you've released to the time you've from the time you have released the vacuum to re-engaging the vacuum, as long as that is 60 minutes or more, then it should not be a problem.
Okay. Let's see. So next question here. Is it safe to use a VED while on blood thinners?
Yeah, you want to be careful, right? The problem here is, do I have patients who do it? Yes. Do we counsel patients about it? Absolutely. The problem is the vacuum erection device, because it's creating such it's a negative pressure and it's pulling blood flow into the penis. Sometimes there's capillaries, these small capillaries can rupture within the penis. And if you're on anticoagulants, your body doesn't stop it the way you would if you weren't on anticoagulants. So I always caution patients about it, to start slow, to slowly build up from there. But it is something to be very, very aware of, where you can't be using this device as aggressively as you would if you weren't on anticoagulants. Really, you have to build up. So if you're on in simple terms, you slowly have to build it up, so your body and your penis, more importantly, get used to it.
Makes sense. Alrighty. Can the VED help with penile shrinkage and enlargement?
It can help with, so we have a lot of patients who are post-prostatectomy, they have erectile dysfunction, and they're waiting for the erections to get better. Sometimes it takes 6 months, it takes 2 years sometimes. And during that process, we always tell patients to use the vacuum erection device, because again, if you don't use it, you lose it. So keep getting good blood flow. Now, can it help you restore the length that you had before your prostatectomy? Or let me say this, if you hadn't had a good erection for 2 years and you start using the vacuum erection device, can it get you to where you were before, to your previous length? Potentially. But can it give you a longer length than what you had even, before you were, in your 20s or 30s? No, this isn't going to give you, it's not a form of penile elongation, but it's a form of rehabilitation or reconditioning, if that makes sense.
Yes, it does. Alrighty. Let's see. Next, we're moving into some more technique questions. Actually, we have one question here. What is the difference between a $20 penis ring and a $150 penis ring? I don't know if that person's asking specifically about the MenMD catalog, because I can answer if that's a question. I know MenMD just got some more expensive ones, but
yeah, if you get, I don't even know what the $150 one is.
Yeah, so I think they might be referring to the MyHixel ring. They basically just released a ring that's less constrictive, if you would, on the bottom of the urethra. So it has almost like a divot. It fits the bottom of the penis to, I guess, prevent blocked ejaculation and give better sensation, if you would. But it's a new product that we just added to the MenMD shop page. So if that was your question, you're asking about that, that may be the difference there. But in general, I think you would agree, Dr. Houman, that a ring is a ring.
Well said. Save the money.
Yeah. Yeah, so if you want to try out a fancy one, go ahead, but we have all sorts of options there, as we do with the VEDs. So let's go into some of the VED technique questions. So after installing the rings, I guess this, yeah, I guess this person's talking about removing the ring from the ring applicator tube at the very end of the VED. So he says he's tried several sizes, and once he removes the ring from the VED, the penis does not become hard enough for penetration. So I'm not sure if it's not fitting or what there, but any tips?
So if you're able to, it sounds like he's able to attain a good erection, but he can't maintain it because the ring may not be the same, may not be keeping blood flowing. If that's the case, then I would downsize on the ring, on the constrictive ring, downsize because that'll constrict a little more, keeping more blood flowing the penis. That's if you're unable to maintain. The other side of it is if you're unable to get a good enough erection or attain a good enough erection, I would really focus on creating a good vacuum seal, number one. Number two, really pump it up to the point of not necessarily being uncomfortable or being painful, but where you have a little bit of discomfort in the penis itself, because that's when you know you've reached the upper limit of the amount of blood flow you could bring in. Yeah, those are the two tips I would give.
Alrighty. Let's see. Due to TRT, testicles shrink and they get pulled into the cylinder of the VED. Is this harmful?
I mean, ideally we don't do that, right? There's ways in which you could avoid that with changing the transfer piece. So you could go a little bit smaller. If you go a little bit smaller, less chance of other tissue or the testicle coming in. It's hard. It's not necessarily harmful, but you don't want to create. If you do, here and there, that's okay. But to do that time after time, to create that kind of pressure and that kind of trauma to the testicle, you're really not doing yourself any favors. So I would do everything I can to avoid it. But if it happens from time to time, it's not a big deal.
Alrighty. Person asks why their penis may go numb when the ring goes on.
In a scenario like that, it sounds if that's the case, it just sounds like the constrictor ring might be too tight, where it's squeezing down, which is doing its job. But if it's going numb, that means it's squeezing not just the blood flow, but it's probably squeezing too tight even on the nerves. Kind of like when you hit your funny bone, it doesn't let you feel much. But yeah, it sounds like the ring is just too tight. Probably upsize the ring at least one size up to see if you could still get the benefits of the ring without any of the side effects with penile numbness.
Alrighty. Next question here. Is there any recommended program for the use of a VED and for overall improvement sexually and physically? So not for rehab.
Yeah, there's no real protocol or anything that's been published on this, but what I would tell you is if it's something that's of interest to you, start off doing it twice a week, 10, 15 minutes, do the exercise of creating a vacuum seal, getting an erection, keeping the erection there for anywhere from 1 to 3 minutes, and then releasing, doing that again back and forth for 15 minutes twice a week. That's probably a good place to start. You could go up to 3 times a week if you'd like, but anything more than that, I would say more than 2 to 3 times a week is probably not giving you much benefit.
Alrighty. Real quick, I have just to follow up back a few questions because I love when people are listening to their questions being asked. So this is great. He says that he's not asking if it does cause harm because it does hurt, he says, and is asking if a medical VED can help prevent the testicles from slipping in to the device, or yeah, what do you recommend there?
If a medical VED could prevent it from.
Yeah, I think he may or may not be using a internet VED versus one from MenMD or another provider similar. So he's wondering if getting one from us could prevent the the problem.
Yeah, I would say it probably would, because these rings, or the transfer rings here, because of the sizes, these sizes are actually really great. It's very difficult, at least with this one, this is the smaller one, to get more than your penis in there. So this will probably do the trick, the smaller one. I would for sure try this one, just because of just from experience, this is probably the most versatile and the most universal. So this really fits men of all shapes and sizes. So I would definitely give this one a shot.
For sure. And when you purchase from NMD, you can call up and ask questions. So that's the best part. Let's continue on though. Let's see. Wider. This person asked, would a wider diameter VED better accommodate someone with Peyronie's disease?
So Peyronie's disease is penile curvature. Now, a wider one, I'm assuming you're thinking that it won't hit the sides of the penile tube. It can, but really a wider one just makes it a little bit more difficult to use, or requires more pumping. There's more space. So if you are experiencing Peyronie's disease and you want to use a vacuum erection device, you are limited in terms of some of the configuration, or the limitations in terms of your anatomy. That goes without saying. Having said that, though, if that's the case, it really is time to talk to a urologist, a men's health urologist, who could help you with your Peyronie's disease. Because at that point, if you're trying to get an erection, you're using these different treatments to get an erection in the setting of Peyronie's disease, there's a lot of great treatment options for Peyronie's disease that will allow you to allow you to get a good, strong, straight erection. So that'd be my recommendation. Talk to a men's health urologist, because you have options out there.
Alrighty. Next question here. I think we can kind of tackle 2 and 1. So this person asks how difficult it is to use the pump, because they have problems with hand dexterity. So perhaps you can talk a little bit about manual versus automatic.
So manual is just easier, because you could really control how much you're going to go. Electric is also great for people who have difficulty with manual dexterity, without question. It serves its purpose, but you just lose a little bit of that control because there's a machine that's doing it. So the manual just gives you a little bit more control in terms of how much suction you could put on it without creating excessive discomfort. But if you are limited, the electric one is a perfect option.
Alrighty, let's see. This is a bit of a review question, but how do I choose the proper ring to size? I guess maybe you can suggest some tips if you don't get that handy dandy card with the thing, and then where's the best place to put this ring once you find your size?
So if you don't have the card, one thing you can do here is pull it up here. So really what you can do is you could kind of size it, use this, the different ring sizes, and just put it on top of your finger. Excuse me, not on top of your finger, on top of your penis. And use that as a guide, a rough guide, in order to see what fits, essentially what fits in here in the flaccid state. That's where I would start. It's going to take some trial and error, because you're going to either have to upsize or downsize depending on that. But ultimately, what I would do is err on the side of a larger constriction ring versus a smaller one, just because it's less painful. So you could always it's easier to downsize than to upsize. So start bigger and then work your way down. And was there a second part to that question?
Second part was the best placement for the ring. They're wondering if it should go around the scrotum as well.
No. Just really at the base of the penis, as close to so if this is the penis and this is your scrotum right here, really you want to get it on the base of the penis, but as close to the body as possible is the best place. Don't get your scrotum in there. It's going to really start to hurt.
Alrighty, let's see. Another ring sizing question, but this is a good one. So if one ring size is not tight enough and the next smaller one is uncomfortably tight, are there other options besides just finding another brand?
One ring size is too small and the other one is
is too tight. So I guess per se, if they were to get the kit that we were talking about tonight and they're kind of in between two of those sizes, where they're asking if there's better options besides just looking for other rings.
Yeah, what I would do is really pump it up more, get more blood flow in there, because if you get more blood flow in, you could find the rings will kind of find their home, if you will. But what I would say is really focus on getting more blood into the penis. And my bet is that you'll find that'll help address the issue in terms of being in that half size. Getting more blood flow in and going to the larger size could probably help you keep the erection without the pain. To focus on more blood flow.
Alrighty, let's see. Alrighty. Next question here is we got a couple about using VEDs with other modalities. So should or can a VED be used in conjunction with injections?
I wouldn't use it with injections because the injections themselves. I would say this: I wouldn't use them at the same time as the injections. Now, if you want to use the VED as a means for penile rehab or penile reconditioning, yeah, that's fine. But I wouldn't inject my penis and then use the vacuum erection device immediately after as a means in which to get an erection. You could use it for practice or for rehabilitation, but not in order to get an erection.
Alrighty. Let's see. And the second one in that category was, can a VED be used with PDE5s like Cialis or Tadalafil?
Yeah, absolutely. With PDE5s, absolutely can be used for that. If your PDE5s are good, but they're not great, you feel like you're getting a 6, 7 out of 10 erection, but you really want to take it to the next level, a vacuum erection device can definitely be a nice complement to that, a nice accessory to that.
All right. Moving along to our pre-submitted questions, and we'll get to some of these chat ones, but we got some prostate questions here. So will a VED help overcome nerve damage from prostate surgery even 2 years after the surgery?
Can it be used?
Yeah, they're asking if the VED will help them overcome nerve damage from their prostate surgery, even if it's been 2 years.
So it won't fix the nerve damage, but what it can help with is bringing blood flow back into the penis and giving you the ability to stretch the penis, rehabilitate the penis, addressing the whole if you don't use it, you lose it idea. But it can't fix the nerve injury associated with the prostatectomy, but it can help you move forward and look ahead to preserve erectile function, preserve your length, preserve your girth. Those are the things that could definitely help with.
And post-prostatectomy, is it necessary to use it regularly?
Yeah, I always like to recommend it to patients early on. Like I'll have them buy it even before the prostatectomy, and usually I'll tell them to start using it a week after. Well, as soon as the catheter comes out, because the catheter has to stay in for a week after the prostate surgery. I tell them to start using the vacuum erection device as soon as the catheter comes out, as a means to get blood flow to the penis, because we've done this for a long time, and I could tell you a lot of guys, they start to complain. They're like, well, my penis size, my length, my girth is not what it was before the prostatectomy. And that's because they were not getting good blood flow for months after the surgery. And if you were one of those guys who it's going to take some time to recover from the surgery, there's no problem in that. That's normal. But it becomes, you really want to get good blood flow into the penis by using the vacuum erection device to maintain that length and maintain that girth during the recovery process.
Certainly. And speaking of the recovery process, I think this is important to just cover it again because I'm seeing it here in the chat. So when using a VED for rehab, what is the proper technique, generally speaking? How many times per week, and how much time per use, and how often per week?
Yeah, so I'll tell guys 2 to 3 times a week, and if you can use it for 20 to 30 minutes each session. So that's the idea, and it's similar to the kind of the prophylactic use, but really it's get blood flow in, keep it there for anywhere from 3 to 5 minutes, let it go, do that again, back and forth, 20 to 30 minutes, 2 to 3 times a week.
Alrighty. And to be specific, is 2 years post prostate surgery too late to start VED if I'm totally impotent now?
No, it could only help. It could only help in terms of preserving or at least trying to get your penile length back. Look, I've had patients who, like these guys have had surgery for, somewhat of an example here, but they've had an inflatable penile implant that's been in. It's had to be removed for infection or just had to come out, but primarily for infection. And the penile tissue inside is quite scarred down. And when I show them if we're going to put a penile implant back in place, the penis is relatively small and they don't like that idea. So I'll tell them, use a vacuum erection device. Really use that aggressively. For those guys, I'll tell them to do it 4 times a week. Really pump it up and keep it there for 30 minutes, 40 minutes each time to really stretch that tissue. And you'll see over the course of months, sometimes 3, 4, 6 months, we're able to add some length to it or get some of that length back and give them a larger penile implant. So bringing it to your question about post-prostatectomy, it's never too late. It could only help, right? There's no harm in doing it. Can it give you inches and inches? Highly unlikely, but it could definitely give you some length, but more importantly, it could definitely give you girth.
Alrighty. We're on to some chat questions now to round out our session. So this is a good follow-up to what we were talking about earlier. This person says, we are told that if we have an erection longer than 4 hours to seek emergency medical attention. So why can we only wear the constriction ring for 30 minutes?
What happens is the constriction ring, because it keeps blood flow in, and because it's a ring, what it does, it could also create swelling around it. So the ring is a little bit different than a natural erection because the ring is so tight, your penis can swell up significantly, distal to it, and as a result of that, if you keep it on longer than 30, 40 minutes, it becomes very, very difficult to take off. That's really the main reason. It just becomes a lot harder to take off, and it becomes more difficult for you as the patient, and then God forbid you end up in the emergency room, it becomes more difficult for us to take it off.
Alrighty, next question here. Should I keep using my VED? I have venous leakage after a prostatectomy 5 years ago. Can get blood flow into the penis, but cannot get an erection.
Should he continue to use a vacuum erection device?
Yeah, so it sounds like there's some venous leak after the prostate surgery with not able to get a full erection while using the VED.
Can you use the vacuum erection device for reconditioning? Yes, but if you're using it as your primary means to get an erection good enough for penetration or intercourse or anything like that, it sounds like you need the next level. You need to talk to a urologist about something more, whether it's injection therapy, a penile implant, but it sounds like you need more than just a vacuum erection device.
Alrighty. With this question, I'm sorry I didn't see this when we were doing the demo, but if you don't mind holding up the VED just to show us the little air gauge on should be near the pump, like the limiter. Should be that thing, yeah, that part. He just wants to get a visual on the limiter right there.
Right there. That's the release valve.
Release valve, limiter thing. Okay, cool. Appreciate that. Let's see. Doing my best to get to all of your questions, so just bear with us here. Let's see. Next question here. What is the best position to use a VED? Is it standing or lying down?
Ideally, standing, just because of the pressures. When you're standing, there's more pressure just from gravity, so less blood flow is going up, more blood is staying down. Therefore, it's whatever erection you've attained, it's easier to keep it there. But if it's too difficult to do it while you're standing up, that's fine. Laying down is fine. Sitting down is fine. But ideally, if you had to choose, standing is the best.
Alrighty. Let's see. Can you use a VED if you have varicose? If I'm pronouncing that right. I don't know if I.
Varicose, absolutely. It's not a rate limiting step. Just make sure you don't get your testicle in there. But if you have varicose, it's not a problem.
Alrighty. Kind of hopping all over the place here. Back to using the VED with other meds. What about VED with IU gel, intraurethral gel?
I wouldn't necessarily start there. I try to maximize the potency of the intraurethral gel as much as possible. But it's doable. It's actually you could do it with the intraurethral gel, yeah. But if it's not working with the intraurethral gel, you should think about injections or at least stepping up to the next level. But you can try it, yeah.
Alrighty. And next question here. What about when someone has neurogenic orthostatic hypertension? Will a VED still be a valid treatment?
Yeah, definitely. You could use it. You could, avoid standing up very quickly. You could do it while you're, laying down. So don't let that limit you at all by any means.
Alrighty. Got a few more questions we're going to ask here, and then we're going to wrap up. So, do the rings need to be stretched over time? This is a question we have here.
Do the rings need to be stretched over time? No. The rings they preserve their elasticity quite well.
Yeah, you probably want them to keep that too.
You want to keep it tighter, yeah.
Let's see. While using the good question. So, while using the VED for rehab for 3 to 5 minutes at a time, are you supposed to use a ring?
Only if you're unable to attain or unable to maintain the erection, yeah. So yeah, let's say you're so there's two things you can do. There's two ways of doing it. The ring really is the main purpose of the ring is for using the erection. But if you're just using it as rehabilitation to reconditioning, the different words we use for it, you don't need to. If you're just using it to stretch and relax, don't use the ring. Only use the ring when you're trying to use the erection that you've just created.
Alrighty, and then we're going to use this as our wrap-up question, and we can answer it in two ways. So how long will I have to use this device? And I guess we can answer it from the ED standpoint and the rehab standpoint, I guess, and that'll finish us out.
How long, like in terms of duration?
Yeah, I guess they're asking if is this the type of thing that you pick up, and I guess we had a similar question earlier as well. Like, is this the type of thing you pick up and recover with, or do you use it long term?
Yeah. So eventually, I feel like most men. So I'll say this: there's no right way of answering or single right way of answering this, but most men, if they're using this for rehabilitation, they'll use it for months, and at some point they realize like, well, look, I've plateaued in terms of this, I've achieved what I wanted to achieve with this. Now I have good, strong erections. I'm at a good length and a good girth, and they fall off and they stop using it. And then that's the rehab men. And the ones who are using it, the VEDs for erections and for intercourse and whatnot, at some point, all of us, our erectile function gets worse and worse. So at some point, you kind of test out of this, or you advance out of vacuum erection devices, and you have to either go to an implant or injection. So eventually, everyone, no one's going to use this forever for the rest of their lives, but it's a great option for many men throughout their ED journey.
We'd like to thank Dr. Houman for taking the time to present this evening. We hope you found it informative and you'll join us again in the future. If you'd like to learn more about VEDs, you do have a few options. There are more resources in the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. If you still have a question tonight and would like to speak to someone in person, you can also call MenMD at 857-233-5837 or log into our portal to schedule an appointment with a personal health assistant. If you're interested in purchasing a VED or perhaps learning how much they cost, you can do this by visiting the shop page on menmd.com or by calling our office again at 857-233-5837.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.